Hi everybody, Neil Kravitz here. I hope you're enjoying these daily clinical pearls. This pearl is about sealing the bands on your appliances. Now sometimes when your patients come back in for their appliance checks, perhaps you're checking whether the appropriate amount of expansion was done, or you're checking the amount of Herbst activation. A lot of times we're not looking at the bands, we're looking at the bite. But the problem is sometimes the cement can wear down and there could be a void around the band, and that could be a food trap that could potentially cause a cavity. So what I always instruct my staff to do is look at the occlusal surface of the bands and make sure they're properly sealed. Now here is a lower holding arch. If we can just imagine that it has already been cemented, I use the 3M luting agent, the 2-part luting agent. I also like band lock, but I primarily use the 3M 2-part glass ionomer. And what I instruct my staff to do if they see any void, particularly around the distal of a band, is just to mix a little bit of cement, use their finger, and just, obviously with gloves on, and just seal that area up and make sure those bands are perfectly sealed at the appointments. So instruct your staff not just to look at how well the appliance is performing, but whether any voids have been created around the bands. Seal them back up with a little bit of Retrofill cement to make sure the patient doesn't get a cavity. I hope you enjoyed this pearl. Thank you guys so much for subscribing to this page. Thank you for supporting the JCO.